My name is Dr. Rahul Mukherjee. I'm a consultant cardiologist and electrophysiologist based in London and in Sussex. I specialise in heart rhythm medicine, which is dealing with both fast and slow heartbeats. And I also specialise in advanced cardiac imaging with cardiac MRI. I decided to become a doctor because I've always been motivated by helping people at times when they may feel worried or uncertain. Working in medicine offers a unique opportunity to combine both scientific knowledge with human connection. And when I see a patient, I aim to treat them as I would a member of my own family, by listening carefully, being honest and clear, and doing everything that I can to support them in making the best decisions for their health. I think being able to guide someone through a difficult or a confusing situation and help them feel reassured is a privilege, and I value this greatly. I chose to specialise in cardiology because this was a specialty that combined detailed problem solving with the ability to make meaningful and often immediate differences to patients' lives. I was particularly drawn to heart rhythm medicine or cardiac electrophysiology because it relies so heavily on listening to patients' symptoms and understanding how those symptoms affect their daily lives. In fact, many heart rhythm problems can be precisely diagnosed and treated, often using advanced and innovative technologies. And being able to identify the cause of a patient's symptoms and offer a targeted treatment, and in some cases a cure, is extremely rewarding. And this is what attracted me to the specialty. What I find very rewarding about the job is the opportunity to make a meaningful difference to a patient's life by truly understanding their symptoms and concerns and then working with them to find the best solution. Many patients with heart rhythm problems often come to clinic feeling very anxious or unsettled or worried about what their symptoms might mean. I think taking the time to listen carefully, explain what is happening, provide reassurance where appropriate, can be just as important as the treatment in itself. I think heart rhythm medicine is particularly rewarding because it allows for very targeted, personalized care. Every patient that you see is slightly different, and finding the correct diagnosis often relies on careful listening as much as on tests or technology. I think being able to use advanced treatments, whether that is medication or device therapy such as a pacemaker or a procedural intervention such as catheter ablation, to improve symptoms, restore confidence, and in some cases offer a cure is incredibly fulfilling. Seeing patients return to their normal lives feeling reassured and in control of their health is what makes the work so satisfying. I think patients often tell me that they value the fact that I take time to listen and that they feel heard and understood. I believe that it is essential to understand a patient's experience from their own perspective, how their symptoms affect their daily life, their work, and their sense of well-being, rather than focusing solely on test results. I place a very strong emphasis on clear and honest communication, explaining diagnoses and treatment options in a way that is easy to understand, and ensuring that patients feel fully involved in decisions about their care. In return, I value patients who engage openly in this partnership. I think the best outcomes are achieved when patients feel comfortable asking questions, sharing concerns, and working together towards finding a solution that fits their individual needs and preferences. I think this collaborative approach allows care to be tailored not only to the medical condition, but to the person as a whole, which I believe is central to delivering high quality, effective and compassionate cardiac care. I think the main challenges within cardiology is the complexity and variation between patients. Even when symptoms may appear similar, identifying the underlying cause can differ significantly, which means careful assessment and individualized care are essential. I think cardiology is a very fast-moving specialty, and staying up to date with rapidly advancing technology and treatments is demanding, but it is a challenge I welcome, as it allows me to offer patients the most effective and evidence-based care available. I think adjectives that I would use to describe my profession would be challenging, rewarding, and continually evolving.